The best treatment for acid reflux is individualized treatment. The person who has a reflux is the best person to know what the best treatment for them is. Treatment can be divided into dietary modifications and lifestyle changes, along with medication to control acid reflux, and finally endoscopic approaches or surgical treatment. As far as lifestyle modifications are concerned, there is good evidence to suggest that in those patients that eating certain food products causing symptoms, the common sense would be to avoid those food products. The other things that one can do to reduce acid reflux would be to reduce the amount of intake of tea and coffee. And it's not only caffeine in the tea and coffee, but it's other compounds such as xanthines, which also causes acid reflux. Reducing the amount of alcohol that you drink, which will reduce the relaxation of the muscle that causes a reflux, is also important. Sometimes some patients find eating spicy foods increases reflux, and if this is the case, then common sense would be to avoid it. Smoking can also have an injurious effect on acid reflux, so avoiding this is also important. Increasing the time interval between your last meal and sleeping is also important. The worst thing that one can do is to eat and then go to sleep, and that can increase acid reflux as a result of recumbency. Large meals, fatty meals, are also important to avoid to reduce the acid reflux. As far as medical treatment is concerned, there's a hierarchy of treatment to control acid. There's the weakest acid suppressants, there's the antacids, which neutralize acid. Then there's something slightly stronger than that. They're the antihistamines like ranitidine or Zantac, which you can buy over the counter. And thereafter the most potent ones called proton pump inhibitors. These reduce acid. Now, as to which medical therapy you use depends on how much the acid reflux is affecting you and how much damage it is resulting in your gullet. And this can only be identified by performing an endoscopy. The amount of inflammation at endoscopy does not correlate very well with symptoms. You can have really bad symptoms but hardly any inflammation, and other patients can have hardly any symptoms but florid inflammation. So an endoscopy is vital to identify the longer term management of reflux. Surgical treatment is really left as a last resort for a fine number of patients, and only after medical therapy has failed.